Dr. Glenn Davies for Reversal NZ Lifestyle Medicine Clinic and for Reverse T2 Diabetes Topor. So what I'm going to talk about today is should you do your blood tests fasting or non-fasting. So this is really only relevant for the lipid panel. So that's when you're measuring triglyceride and cholesterol. Most of the other blood tests, it makes no significant difference. Okay, so why is this important? So I'm talking about doing your blood test in the morning before you've had breakfast. So that's around a 12-hour fast. So this is important because the triglycerides, which we are measuring on a fasting sample, are the triglycerides that you are making from excess carbohydrate, not the triglycerides and cholesterol that you have eaten. Okay, so that's the main point. When you do a non-fasting sample, you are testing both the triglycerides that you make and the triglyceride that you have eaten. When you do it on a fasting sample, you are just testing the triglyceride that you are making, and as you know already, you make that triglyceride from excess carbohydrate. So excess carbohydrate through the process of de novo lipogenesis makes triglyceride, and that's the triglyceride that ends up eventually in your fat cells or back in your liver as non-alcoholic fatty liver disease or in your arteries as atherosclerosis. So we're wanting to know how much triglyceride you are making, and that tells us if you are having excess carbohydrate in your diet for you. So ultimately what we're aiming for is to get the fasting triglyceride divided by HDL ratio less than 0.87. Now, if your fasting triglyceride divided by HDL ratio is less than 0.87, then your LDL cholesterol is in the healthy form. So you are not making small dense LDL. The LDL has not been damaged by glycation or by oxidation, and you are not going to be depositing atherosclerotic plaque or cholesterol in your artery walls. So this triglyceride divided by HDL ratio is really important, and we calculate that on a fasting sample. So next time you're asked to do a set of blood tests to look at your lipids, do it fasting, and then sit down and calculate the triglyceride divided by HDL ratio. If it is less than 0.87, then you're fine. If it is more than 0.87, then you need to reduce your carbohydrate intake to reduce your triglycerides. And of course, being a ratio, the other thing you can do is push up your HDL. That's been referred to as good cholesterol, and you do that by eating healthy fats and by exercise. Thank you.